Arena.
Hi.
Now, Peter, are you still there and ready to give us to talk about the digital health record?
Absolutely, and good evening, everyone.
Thanks.
Thank you so much.
Thanks for waiting for so long.
No, my pleasure, and thank you so much for inviting us and letting us be here. I'll share a quick presentation, and it won't be a long presentation, and take you through what we're doing and how it's working. Also joining me this evening, I've got Melinda Bauer, who is our patient experience lead, and also Joe Lewis, who leads all of our clinical engagement and change. So first of all, I'd like to acknowledge traditional custodians of the land upon which we're meeting, for those in Canberra, of course, the Ngunnawal people, and pay my respects to their elders past, present and emerging. I'd also like to welcome the other Aboriginal and Torres Strait Islander people who may be with us this evening. And this is an artwork that ACT Health commissioned in the last year or so that actually is in the main foyer of our building in Woden. It's a really nice piece of art that I wanted to share briefly with you this evening. The digital health record, and I'm sorry, it's a bit of a strange one. I'm the Chief Information Officer. I'm talking about an ICT project, which is normally always a very boring thing. And so I want to talk a little about what it is and why it actually matters to our community. At the moment, we operate over 254 different clinical ICT systems across the ACT public health system, whether that's Calvary or Canberra Hospital or any of the walk-in centres and community health centres all across town. What the digital health record is, and it's a project that's now 51 days away from go live, is putting in a new system that's one single record for all clinical interactions across that whole public health system. And it's very much focused around being a patient-centered record, a record that gives all our clinicians a single view of a patient and gives them access to the complete information about it. We're implementing across 45 different sites in the ACT, everywhere from AMC and Bimbri through to walk-in centres, community health centres, community-based nursing staff, and of course the hospitals. It is, whilst I'm the Chief Information Officer, fundamentally it's a clinical transformation project. We're just happening to use ICT as the excuse to do it, and that's very much how it's being driven. The project has been designed from the ground up to be a clinical tool to help patients and to help our clinicians who care for them. And that's really drives everything we do. And the program board established some principles very early on this program, 3+ years ago now, which fundamentally, and I think that it's the first one that really gets to me, every decision we make, we're based on putting patients first, always. It's about how do we provide that better outcome? How do we provide it safely? How do we make it easier for healthcare consumers to actually have access to their information? And how do we ensure it aligns with all the health services are doing? The way we've designed the process was it's been clinically driven and driven by healthcare consumers. That goes right back to the original procurement and the request for tender, where those requirements were informed by both healthcare consumers and by clinicians. It also goes back to our, once we actually had issued the request for tender, where we actually held town hall meetings where clinicians and healthcare consumers actually came in to see the system and actually voted on what they wanted. And our tender evaluation team also included, was primarily clinicians and healthcare consumers. And so quite a different way that we've done the procurement than the normal way you would do it in a government. But I think really it's given us an exceptionally good outcome. As part of that, we have about 40 to 50 different steering committees and groups and all sorts of things as we bring 14,500 staff across the system together. One of the most important of these is, in fact, is our Consumer Experience Steering Committee. And this is where we really bring together the whole range of different representative groups across the healthcare consumer spectrum. And Melinda, who's online, actually really is the group that she works with these people day in and day out to ensure that what we're designing works for all of us across Canberra, both now and into the next 10 or 20 years. So it's one of those things, it's an ICT system, and I have to confess, look, I'm a Chief Information Officer. I can't get excited by a box and wires and those things. What I get excited about is that transformation. And so anyone who's actually been to one of the mass vaccination clinics, when we were doing all the COVID vaccinations that were operated by the ACT government, has actually already used the system. And so you'll see here what we're doing is there's nearly 3,000 clinical grade smartphones that the staff will be using, and the sort of, you can see a couple of the pictures sort of top left and top right, where the staff are actually able to look for records. There's what we call lovingly a computer on wheels, or a cow, in the middle there, that actually is where the staff can access the records. And so we've already been using this for nearly 18 months now, first for COVID vaccinations and anyone who's been involved in COVID care at home. Hopefully, if you have, you've recovered, but one of the things we were doing was actually using this system for it. And it really does give our clinicians the ability to save time, to bring the information together, and most importantly, to actually spend more quality time with patients rather than doing pointless administration that has to be done but distracts them from care. The true measure, I think, and look, I'm a bureaucrat, the majority of staff who are actually driving the program are clinicians, the majority of staff who are working on it are clinicians. And we asked a couple of the clinicians who are actually sort of providing care day in, day out, what they thought of it. And realistically, I think this really summarises why we're doing this and what it actually means. It is fundamentally changing how healthcare is provided in the ACT. We very much expect, and we've seen this in other sites overseas where we've gone and visited and we've watched what they've done and we've read their case studies, it enables the staff to much more quickly and easily work with the healthcare consumer to actually have access to all that information that matters, but also to ensure that the healthcare consumer's wishes are recorded in a way that really we haven't been able to do before. And pastoral care is a particularly good example where historically we really haven't had anything of substance that actually helps them engage with patients and have all that information recorded. From a clinical perspective, some of you may know Giles. How do I describe Giles best? Is probably one of the most demanding clinicians I've ever had the pleasure to work with in my time, and I normally dread the calls from Giles. But fundamentally, I think what he's coming through is he's spent years working on how does he make systems more efficient, how can he analyse data, and he really works a lot primarily with dialysis patients in the renal service. And some of his feedback that actually he got to shape how it works, that we've taken the best practice from overseas and we've actually modified it for what works in Canberra, really I think is a tremendous advantage. So things like this really make me think that actually we are on the right path. What does it actually mean for consumers? And look, fundamentally on day one, I can't sit here and say that as a healthcare consumer, any of us will see a massive change. What we will see over the next year, 2 years, 5 years, 10 years is, first of all, bringing all the information that is held in the public health system together in one place so clinicians can treat us faster, they can access the data and they can bring it together a lot more readily. Secondly, it also creates over time linkages, whether that's into the national My Health record system, whether that's into our GPs in primary care, or into things like physios and allied health professionals in the community sector, so that all of our care is a lot more joined up and the information about us is in one place. And this is Jen is a patient who's had some quite debilitating long-term chronic conditions. And actually she did some work with us in the ABC a couple of years ago, talking about what it actually meant to her. And those books in front of her, you'll see, it's actually a pile. There's just some on the table there. They're A4 size books. If you put the pile on the floor, it came higher than the table. And what she had to do is take all that information to every single appointment she had with a different medical professional because the information just didn't travel. And so that's really the power that we see in this, and that the healthcare consumers that we've been working with are pushing us to deliver. The other part that we're delivering is a patient portal, and this is called My DHR, and just over half of all Canberrans currently have access to this, use it for either COVID care at home or booking COVID vaccinations in the mass vaccination clinics. It's nothing exciting, and at the moment you'll see it doesn't have a huge amount of functionality. As we go live with the full system across all healthcare services, and we're going live at 4 a.m. on Saturday the 12th of November, and we're turning off 40 systems on day one, and over the next year another 100. The DHR really will start having a lot more information for patients who've been through some of our public health services, particularly the hospitals, the community centres and walk-in centres, but also community nursing particularly. And in that portal, you'll actually be able to access things such as your after visit and discharge summary, things that often today might take 1 day, 2 days, a week to get out to GPs. Any pathology and imaging done through the public system will be available immediately. And a whole lot of those other bits and pieces that are just help us do our day-to-day lives, such as appointment reminders, surveys, and really in relation to expecting mums, a whole lot of work around pregnancy and some of the different tests there. And of course, we have the ability for people to have access to people's records other than their own, such as, for example, for children or someone you might be a guardian or carer for, to share that information. That's really where we're going. The system goes live in 51 days. That feels to me and the team, I think we're on a very fast downhill run. Fundamentally, where we're up to now is we've largely completed our testing. We're currently training 14,500 staff across the public health system, and we go live on November the 12th. That is the beginning of the journey for us. And what it means is we can then work with the community and our clinicians over the next 2 to 3 years to really optimize it, to get some of the benefits from it. And we have this system for at least a decade in the public health system, we hope longer, to actually give us that longitudinal record and really improve health outcomes across Canberra. And with that, that's the information I had to share. I'm very happy to take questions or to answer any of the weird, wonderful things that I know. Talking about an IT system isn't always the most exciting, particularly in an evening, but we really want to share with you what we're doing and to see if there's anything we can provide additional information for you on.
Thanks heaps, Peter. The immediate thing is, my immediate thought is it makes eminent sense. But one of the issues is, can you be hacked?
Look, the answer is realistically anything that exists on a computer sooner or later can be hacked. We are putting in a huge range of protections. The level of protections we're putting in, it's already the most secure area of the ACT government's ICT network. Anyone who's ever worked in the public service, particularly at the Commonwealth level, the system is rated in all the hosting levels to what's called protected level. That is the most secure protections we actually have in the ACT government. Nothing in this world is foolproof, but we have many different layered steps to provide the best possible cyber protections.
Any other questions? Well, the other thing is, when there's a power down, we are stuffed.
Absolutely not. So the hospitals are one of those lovely beasts where we presume the power never goes out because we have 5 million different backup systems in place for it. The way we've designed it is we have 2 different data centres across Canberra that are geographically diverse. Each of those data centres also has on-site battery backups as well as diesel fuel to last over a week before they have to be topped up. All the connections between there and the network to the different hospital sites goes through multiple redundant fibre optic connections where it doesn't require power in the middle. And in all the hospital buildings, we have essential power, which in essence is a combination of batteries and generators. Presuming all of that fails, and if that does, I think it's a very unpleasant day in Canberra. We also have additional backup in terms of, we have what's called a business continuity PC in every single outpatient clinic in every single ward, which lets the staff print a copy of the patient's record. It's updated every 5 minutes, so that the absolute worst case scenario, if everything else goes wrong, is there is a printed record that can be put at the end of the patient's bed that contains all of their information, everything that's up to date, and no more than 5 minutes old. So we have all those steps in place, and our business continuity teams have gone through it and tested it repeatedly because technology fails. We just need to plan.
Awesome stuff. Marianne, you need to unmute yourself.
Sorry about that. Peter, this is not being facetious. I'd be very much like you to run this by the extraordinary Dr. Norman Swan.
Always happy to. And in a former career in the Commonwealth, I actually did some work with him on something else around patient blood management.
Right. I'd be very keen to hear how he would rate it and whether he'd be prepared if he lived in the ACT, whether he'd be happy about it.
No, very happy to reach out to him. It's been a couple of years since I spoke to him and his lovely wife, but yes, he's always a pleasure to deal with.
Terrific.
Neil.
Thanks, Peter. I was wondering how it fitted in with the Commonwealth health records.
So the digital health record, I suppose, is that full, complete system that we're putting in here that contains every single element about a hospital admission or something that happens in the community. So if you think about it, if you're in hospital for a week, that might generate 300 to 400 pages of documentation. what we will upload to the Commonwealth system, My Health Record, is maybe a 4 to 6 page summary of that admission. So what we do is Canberra Hospital is actually the first public hospital in the country to be connected to My Health Record, or PCEHR as it was called back, and only public service can design an acronym like that. All of our clinical staff with the appropriate permissions can access the My Health Record through this system. We upload documents to it. And we also have the ability, if there's anyone else using the same software in Australia, which there's 4 major hospitals in Melbourne already using it, to exchange with patient consent the full record with them as well. So it really is designed around the idea that this is a record about individual people, and we tie into whatever source of information we can find.
Thank you.
Thanks, Heath, Peter, and the team. This is, I think, really impressive what you're trying to do there.
Can I just ask a quick question about who has access to this information and what rules govern who has access to that? Are they legal rules or are they administrative rules? Or and because obviously this information is very valuable and people may not want their information being shared to various people.
Look, absolutely. Look, there's both administrative rules and also legislation. So the 2 primary pieces of legislation is the Health Records Privacy and Access Act, which has quite severe penalties for people having unauthorised access to clinical records. And in essence, the way it's defined there is we talk about clinicians who are part of the people who are part of the treating team. So that can be nurses, allied health, doctors, GPs. If you are not part of the treating team and you don't have a fundamental business reason to access the record, that's actually an offence that's a criminal offence that can result in both jail time for prosecution for medical professionals and those who are registered, so nurses, doctors, allied health. They can actually have their registration to practice in Australia revoked as well, and is normally grounds for termination. So there's quite severe penalties for inappropriate access to it. There's also further protections in the Privacy Act that go beyond that for other elements, particularly when there's data sharing across state borders. And we have quite sophisticated techniques built into the system in terms of actually running audit reports automatically to flag who was not part of a treating team who accessed someone's clinical record. And so the health information services of both of the 2 major health providers in Canberra will actually be running that every single day to look for any inappropriate access of records. Finally, there are some health services that are somewhat more sensitive, and some of these are things like some of the sexual health sites and some of those type of things where it isn't necessarily always relevant for someone who's treating you for something else 5, 10, 20 years down the path to know what happened with a previous encounter, perhaps for a sexually transmitted infection. And so we actually have the ability to lock some parts of those records away. And if for some reason a clinician needs to know, they can hit what's called a break the glass function, which actually lets them access that full record, but then also generates a flag for that access to be immediately reviewed by the treating team. And they actually have to justify why they needed to know it. So there's quite a few protections. And what I would say is the people who are putting the system in, we all live here and we work here and we all recognise Canberra has 0 degrees of separation. And I know an awful lot of people across the public health system. So I think we're really focused on that privacy, because the last thing I want to do is think about I'm sitting in a room with someone talking about something and I'm going and they read my medical record 3 days ago because they were bored and they were looking. So we've done a huge amount of work around the privacy and the protection. And we also have a privacy impact assessment that's been done externally. We publish on our website just prior to go live.
Leon.
Yeah, if somebody accesses my record, will I be told about it?
No, you won't be told about it if someone accesses your record. You can, in the same way that you can get access to all of your records now held by a health service or a health provider, you can actually access, if you request, and see who has accessed your record. But by default, you won't be told if a doctor or a nurse or someone else has looked at your record.
Right. What about somebody who shouldn't be accessing it?
If there has been any inappropriate access to your record, you would actually be notified of that as part of the investigation by the health information management teams in the hospitals to say there has been inappropriate access, action has been taken. Based on what that action is, sometimes they'll be able to tell you exactly what happened to that person, sometimes they won't. Realistically, if those things happen, normally you read about it in the newspaper when you see someone's been prosecuted or jailed or deregistered for inappropriate access.
Mm-hmm. Okay.
Thanks heaps, Peter.
Thank you so much for the opportunity to talk to you all this evening.
That was good. Yeah. Now, folks,